So we now will discuss a very basic yet very important chapter in pediatrics, that is growth. Okay, what do you mean by growth? So growth basically refers to increase in physical size. Okay, so first, a zygote is formed, the product of conception. Then it is called embryo for the first 8 weeks. Okay, so let us see the terminologies that we use. So first the zygote is formed, then it is the embryo in the first 8 weeks. Then we call it the fetus. Okay, in rest of the intrauterine life. Then the baby is born, that is the neonate. So neonatal period we know is the first 28 days of life. Then comes the infant. So infancy is the first year of life. Then comes the toddler. Okay, so the toddler is from 1 to 3 years of life, right? Then comes the preschool age, 3 to 6 years. Adolescent age group is 10 to 19 years. The WHO definition of adolescence, and that comes in a separate MCQ as well. Adolescent age group, very important, is 10 to 19 years. So you can appreciate a huge magnitude of increase in physical size is taking place from a zygote to embryo, fetus, neonate, infant, toddler, adolescent, adult. Right? So this huge magnitude of increase in physical size that is taking place is called growth. Okay. Now, if you are sitting in your pediatrics clinic and if a mother comes to you with her child and she asks you, is my child growing appropriately or not? How do you answer her? So, we have to assess the growth of a child using certain anthropometric parameters, okay, like the weight, the height, the head circumference, okay. So, let us write down that the growth is assessed with the help of, so growth is assessed by anthropometric parameters like the weight, the height, head circumference, so we'll be discussing in detail about these three parameters because you get a lot of questions from them. So growth is assessed by these anthropometric parameters, and there are some other parameters also about which we need to know a little, like the mid-arm circumference, the skin fold thickness, the chest circumference, the body mass index are some of the other examples. Okay. So growth is assessed by the help of some of these anthropometric parameters. Now a little bit about these parameters before we move on to the more important ones, that is the weight, height and the head circumference. The mid-arm circumference. The name itself is telling you are taking the circumference of the middle point of the arm. Okay, so that is the mid-arm circumference. Now, what is the device that is used by health workers? So that can come as a question. The device used by health workers to measure mid-arm circumference. So what is that? It is called a Shakir's tape. Okay. So Shakir's tape is nothing but a measuring tape with centimeter and millimeter markings. And it has got 3 zones, a red zone, a yellow zone and a green zone. So there's a red zone, a yellow zone and a right. So it is a measuring tape like this. So if the mid-arm circumference of the child lies in the red zone, that indicates that the child is malnourished. Okay. If it lies in the yellow zone, it indicates borderline nutritional status, and green means normal nutritional status. So if the child's mid-arm circumference is more than 12.5 centimeters, it lies in the green zone and it indicates normal nutritional status. Yellow is between 11.5 to 12.5 and it indicates borderline. Right? While red zone is less than 11.5 and it indicates malnutrition. Okay. So that is the Shakir's tape which is used. Can come as an image-based question for you. Now regarding the skin fold thickness. So if you take a fold of skin, you're always lifting some amount of subcutaneous tissue along with it. So the skin fold thickness also gives you some idea about the growth and nutritional status of the child. Okay. So the skin fold thickness, you need to know what is the device used to measure it and what are the areas where you usually measure it. So the device used to measure the skin fold thickness So the device used to measure skin fold thickness is called Harpenden calipers. Okay, Harpenden calipers. Right? And the areas where the skin fold thickness is usually measured, the suprascapular area, subscapular area, over the triceps, over the biceps. They are the usual areas. Okay. So you take the skin fold thickness usually is taken at suprascapular area, subscapular area, biceps, over the biceps area and over the triceps area. These are the usual areas where the skin fold thickness is taken. Now regarding the chest circumference. At birth, who can tell you, do you know at birth what is more, the head circumference or the chest circumference? So the head circumference is more than the chest circumference at birth. Okay. So at birth, the head circumference is more than the chest circumference. By around 9 months to 1 year of age, the head circumference becomes equal to the chest circumference. Okay. By 9 months to 1 year, the head circumference will become equal to the chest circumference, and beyond 1 year age, normally the chest circumference should be more than the head circumference. Okay. Now what about the body mass index? So the body mass index depends upon both the weight of the child as well as the height of the child. Okay. So we need to know the formula of body mass index. Sometimes that is asked in the MCQs. So the body mass index is weight in kgs by the square of height in meters into 100. Okay. So that is the body mass index, right? So body mass index can also be used to have an idea about the growth and nutritional status of the child, right? So these are about some anthropometric parameters that we can use to assess the growth status of a child. Now, what if you measured the weight or height or head circumference of the child? Now, how do you know whether it is normal or less than expected or more than expected? So, what we do is we use something known as growth charts to assess that. Okay? So, we need to know a little bit about the growth charts before moving ahead. So, let us see what all we need to know about the growth charts. So growth charts are nothing but graphical representation of the anthropometric parameters. Okay. Graphical representation of the anthropometric parameters. Okay. Now growth charts give us some idea about how the child grows with time. So one of the oldest growth charts which were there were the NCHS growth charts. Okay. So the NCHS growth charts, National Center for Health Statistics growth charts, came in the year 1977. Lots of growth charts came in between. Another important one was the CDC growth charts, Center for Disease Control and Prevention. We all know CDC, right? So CDC growth charts came in the year 2000. But the most important growth charts, which are used till date and which are the preferred growth chart for under 5 children all over the world, are the WHO growth charts. They are very, very important and we need to know some more details about it. Okay. So the WHO growth charts came into use in 2006. Right. So we need to know some more detail about these WHO growth charts. So let us see what are the things we need to know about the WHO growth charts. So these WHO growth charts are the preferred growth charts or growth charts of choice. So they are the preferred growth charts for under 5 children all over the world. Right? So why are they the preferred growth charts? Let us see what is the speciality of WHO growth charts. So WHO growth charts are based upon MGRS. WHO growth charts are based on MGRS. So MGRS refers to multi-center, growth, reference, study. That was conducted in 6 countries across the world, including India. Okay. So once there was a question, all of the following are true about WHO growth charts except, so the incorrect option, so the answer was that the data was collected from 6 states of US. So it's not 6 states of US, the data for WHO growth charts was collected from 6 countries across the world including India. Okay. So the countries that participated in this MGRS study include Brazil, Oman, Norway, Ghana, US, and India. And from India, the samples were taken from New Delhi. So you can remember this by a mnemonic Bonjui. Okay. So Brazil, Oman, Norway, Ghana, US, India. So data was collected from these 6 countries across the world. And in this MGR study, they ensured that they took only those babies who were exclusively breastfed in the first few months of life. The CDC and NCHS growth charts, which came previously, on the other hand, they included mainly formula fed children, bottle fed, top fed children. So, obviously, their growth was not, what the growth of a normal child should be, because till then, breastfeeding is the norm, was not so well established. So, this MGR study ensured that they enrolled only those babies, enrolled those babies who were exclusively breastfed in the first few months of life. And they also excluded factors like maternal smoking, maternal alcohol intake, which can interfere with the growth of the baby. Okay. So that makes the WHO growth chart so important. Not only this, in the WHO growth chart, you have growth charts available for almost all the anthropometric parameters that you can think of. Okay. So in WHO growth chart, you have growth charts available for, so WHO growth charts available for weight for age, weight for height, height for age, head circumference for age, mid-arm circumference for age, skin fold thickness for age, right? Body mass index for age, and you even have growth charts available for major motor developmental milestones as well. So you can see growth charts are available for almost every anthropometric parameter in the WHO growth charts. Separate charts are available for boys and girls for each parameter. Okay. Separate charts for boys and girls. And for each parameter, you have 2 kinds of charts available. One is the percentile based growth charts, and another is the standard deviation or Z score based growth charts. Okay. So, 2 types of growth charts are available. So, one is the percentile based. So, where you have, just for example, if it is height for age, you have lines like 50th percentile, 10th percentile, 3rd percentile, 90th percentile, and so on. So, that is the percentile based charts. And you have standard deviation or Z score based charts also for each parameter. Okay. Standard deviation or Z score based charts. So, where again, for example, if it is a chart for height for age, So you have lines like 0, -1 standard deviation, -2 standard deviation, +1 standard deviation, +2, and so on. So that is standard deviation or Z score based. So you can use any of these charts. You can use either percentile based charts, or you can use standard deviation or Z score based charts. Okay. So that makes the WHO growth chart so important. So you can see that data was collected from all over the world, different countries, okay? And exclusively breastfed babies were taken. Factors like maternal alcohol, smoking, which can interfere with the growth of the child, were excluded. And you have growth chart available for almost every anthropometric parameter, and you have both standard deviation as well as percentile based growth charts available for each parameter, right? But all said and done, WHO growth charts are the preferred growth charts only for under 5 children all over the world, okay? Beyond 5 years of age, even at AIMS, we used to use the Indian growth charts or the contemporary growth charts which are available. Because even though WHO growth charts are available till around 19 years of age, but the date beyond 5 years of age, the WHO growth chart is based upon previous extrapolated data, no actual study for the charts beyond 5 years of age. So beyond 5 years of age, WHO charts are not so much preferred, though they are available, but you can use, the contemporary Indian growth charts which are available beyond 5 years of age. So let us know the names of a few Indian growth charts that we can use. So examples of Indian growth charts are the IAP growth charts or the Indian Academy of Pediatrics charts. IAP is Indian Academy of Pediatrics. Then there are some K.N. Agarwal charts. Khadilkar growth charts. So these are examples of some of the Indian growth charts that can be used. Okay. So that is about the growth charts.